In this video, we're going to dive into 12 unusual signs that might show your liver is in trouble. It's really important to be aware of these signs because if you know them, you can take actions to help prevent any liver disease from getting worse. The amazing thing about your liver is that it has this incredible power to fix itself, but it does need a little help from us to do so. Many people think liver damage is mostly caused by drinking too much alcohol, but that's not the full picture. The truth is, eating too much sweet and processed food, drinking lots of sugary drinks, using certain types of oils too much, eating a lot of fast food, or frequently taking pain relief medication like acetaminophen or ibuprofen can also harm your liver. That's not all. Viruses can cause serious liver diseases like hepatitis, and there are many more factors that can hurt your liver. So, if you're curious about how to spot liver problems early on, make sure to watch this video till the end. We're not just going to talk about the signs that something might be wrong with your liver, but we'll also share some easy, natural ways you can help cleanse your liver and stop any damage from getting worse. Stay tuned. Number 1. Light-colored stools. When you first notice problems with your liver, one of the early signs can be noticing that your poop is a lighter color than usual. Here's why. Your liver helps you digest food, especially fats, by releasing something called bile acids. These acids mix with the food you eat and help break down the fats, which also gives your poop its normal brown color. However, if your liver isn't working properly due to conditions like fatty liver disease or other kinds of liver damage, it might not release enough bile. This leads to a change in the color of your stool. It can turn light-colored or even look like clay. Moreover, your stool might end up floating in the toilet rather than sinking. This happens because if fats from your food aren't properly digested, since there's not enough bile, they make your stool lighter and able to float. Remember, paying attention to changes in your stool, like its color or floating, can give you a heads up about your liver health. Number 2. Difficulty with night vision. If you have trouble seeing when it's dark or in places with low light, especially at night, it might mean you're not getting enough vitamin A. This vitamin, also known as retinol, is super important for your eyes. It helps the rod cells in your eyes adjust to different levels of light, which is what allows you to see well in the dark or dimly lit places. Your liver has a big job in making sure you get enough vitamin A. It helps your body use the vitamin properly. But if your liver isn't working right, it can mess up this process. When your body doesn't absorb enough vitamin A, you might get night blindness. This means it's hard to see in the dark, which can be a big problem for driving at night or moving around safely in your home after the sun goes down. Another thing to keep in mind is your gallbladder. If it's not working well, it could also lead to problems with vitamin A absorption. If you have night blindness and notice your eyes feel dry, sore, irritated, or gritty, it might mean your gallbladder is congested. In short, being able to see in low light is crucial, and vitamin A plays a huge role in that. If you're having difficulties, it's worth checking out if you're getting enough vitamin A and making sure your liver and gallbladder are healthy. Number 3. Swollen right foot. The third sign to watch out for is a swollen right foot. This issue often arises when your liver isn't working properly. Your liver might become enlarged or swollen because the blood isn't flowing through it as it should. This swelling can put pressure on a crucial vein called the portal vein. When this happens, fluid starts to build up in parts of your body, like your legs or feet, leading to swelling. If you try pressing on the swollen part of your foot with your finger, you might notice that it leaves a dent, which is a sign of this fluid accumulation. If you see that your right foot or ankle is puffier than the left one, this could be an indicator of liver problems. Don't worry though, because later on, we'll talk about natural ways to help improve the health of your liver. Number 4. White eyelid growths. Sometimes, when your liver isn't doing well, you might notice small white or yellow spots popping up around your eyelids. Think of these spots as little piles of cholesterol that get stuck under your skin. Normally, your liver helps break down cholesterol, but if it's having a hard time, the cholesterol has nowhere to go. So it ends up gathering in places like your eyelids. These spots are a sign that there's too much cholesterol floating around because your liver can't process it all. Number 5. Pressure on the right side. This is another hint that your liver might not be in the best shape. Imagine you eat a big meal and then start feeling an uncomfortable pressure or kind of an annoying squeeze on the right side of your body, right under your rib cage. This weird feeling is because when your liver is damaged, it can mess up the bile. That's the digestive juice it makes. Instead of flowing smoothly, the bile gets all thick and gooey like mud. This thick bile can get stuck in the tiny tubes that go to your gallbladder, which is a small organ that helps with digestion. When this happens, you might feel this pressure and discomfort around your ribs. But that's not all. This pressure can even mess with a nerve called the phrenic nerve, which runs near your liver and goes up toward your neck. When the bile gets all backed up and causes pressure, it can make this nerve act up. This can lead to your muscles tensing up and can cause pain around your right shoulder area. So, if you notice this kind of pressure, especially after eating, it might be your liver telling you it's having a tough time. Number 6. Purple and red spots on your skin. This happens when your liver isn't working right, maybe because it's swollen or damaged. Normally, your liver makes proteins that help your blood clot, but when it's not in good shape, it makes fewer of these proteins. As a result, you might bruise more easily than usual. Sometimes, you might also see unusual purple or red spots that kind of look like a rash. These can also come with small red patches. These signs are more common on the legs or arms. They happen because the liver problem affects how blood circulates in your body. This issue can also be linked to diabetes. Number 7. Cracked heels. Let's talk about cracked heels. Your body needs vitamin B3, also known as niacin, to keep your skin strong, smooth, and moisturized, protecting it from damage. However, if your liver is not working well, your body uses up its niacin to fix liver damage. This means there's less niacin available for your skin. As a result, the skin on the bottom of your feet and your heels might become dry and cracked. To help with this, you can eat more foods rich in vitamin B3 and deal with the root cause, which is often a condition called fatty liver disease. Number 8. Constant need to scratch. Another issue linked to liver problems is feeling a constant need to scratch, especially the palms of your hands or the soles of your feet. This itchiness happens because of too many bile acids building up under your skin. Normally, the liver filters out these acids, but when it can't do its job well, the acids accumulate, leading to more histamines in your blood. These histamines are what make you feel itchy. Number 9. Color of nails. This sign involves changes to your fingernails that may indicate liver damage or other health problems. If your nails start losing their normal pink color and turn completely white, or if they begin to look round, like clubs or bulbous at the tips, this could be a warning sign. These changes happen because the condition can affect how well oxygen is delivered to the nail matrix, the part of the nail responsible for its growth. Back in the 1950s, researchers discovered an interesting fact related to this. 8 out of 10 people who had severe scarring of the liver also had fingernails that were completely white. This shows how certain changes in your nails can be linked to serious liver issues. Number 10. Dark urine. Your liver is incredibly important because it helps break down old red blood cells. These cells have a yellow pigment called bilirubin. When your liver or gallbladder gets damaged, bilirubin can start to build up in your body. Instead of being processed properly, it can end up coming out when you urinate. This is why you might notice your urine becoming really dark, with colors resembling dark orange, amber, brown, or even cola. It's a sign that your liver isn't handling the bilirubin like it's supposed to. Also, taking certain medications, like antibiotics, sleeping pills, or birth control pills, can make your liver work harder. This extra strain can also change the color of your urine to that dark color. Number 11. Yellowed skin. Something might be wrong with your liver is when your skin starts to look yellow. This happens when your liver isn't working right and can't properly remove a substance called bilirubin from your blood. Bilirubin is normally processed and eliminated by the liver. If it builds up, it can turn your skin and even the whites of your eyes a yellow color. This condition is called jaundice. Jaundice is a serious sign of liver damage. It could be caused by liver diseases like hepatitis or cirrhosis, which is scarring of the liver. Sometimes it might also happen if you're poisoned by drugs or medication. If you notice your skin turning yellow, it's really important to get medical help right away. You should see a doctor to find out what's going on. Number 12. Spider veins. Spider veins look like tiny red marks on your skin, with small lines coming out from them, kind of like a spider's web. This happens when small blood vessels near the surface of your skin get damaged. One reason for this damage can be because your liver isn't doing its job properly by filtering out too much estrogen. When there's too much estrogen in your body, it can make the walls of these vessels weak. This weakness causes them to widen and become visible as spider veins on your skin. If you notice spider veins or any other signs we talked about, It's a good idea to see your doctor and possibly get an ultrasound to check on your liver. How to reverse liver disease. Your liver can go through 4 stages of damage. First, it might store too much fat. After that, it can become inflamed, then scar tissue might form, a condition called fibrosis. The most serious stage is cirrhosis, where the damage can be life-threatening. But there's good news. Your liver has an amazing ability to heal and regenerate itself. By eating healthier foods and making better lifestyle choices, you can help your liver recover and even reverse some of the damage. Here are some key steps to improve liver health in a more straightforward way. 1. Change your diet. Start by eating less sugar, starchy, and flour-based foods. This means cutting down on things like bread, cookies, candies, ketchup, pancakes, pasta, and soda. Your liver doesn't respond well to fructose, which is the sugar in fruits, and it can be as harmful as alcohol for a liver that's not in good shape. 2. Eat bitter and sulfur-rich foods. Include foods in your diet that might taste a bit bitter or are rich in sulfur. This list includes leafy greens, artichokes, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, eggs from pasture-raised chickens, wild salmon, oily fish, walnuts, onions, scallions, and broccoli sprouts. These foods help decrease fat in your liver. They boost levels of glutathione, a powerful antioxidant that supports the liver in getting rid of toxins. 3. Start your day with organic coffee and turmeric. Begin your morning with a cup of homemade organic coffee mixed with a teaspoon of turmeric. The compounds in coffee and the nutrients in turmeric can help prevent the liver from forming scar tissue and aid in repairing damage that might have occurred from things like alcohol, drugs, or too much sugar. 4. Drink mineral water. Drink at least 1 liter of high-quality mineral water every day. This helps in thinning your blood, which supports your liver in producing bile. Bile helps in breaking down fats and aids in the elimination of toxins from your body. For an extra boost, add some freshly squeezed lemon or lime juice to your water, which can also help in detoxifying the liver. By following these steps, you're not just working towards reversing liver damage, but also contributing to your overall health and well-being. Thanks for watching.